this is me Arzu here, and I welcome you to my channel Mr. Neet, where your dental concept get dissected. So this is our part 3 video of the impression material, and in this video we will be discussing with the zinc oxide Eugenol. Okay, zinc oxide Eugenol impression paste. I think many of us have used this compound in our clinic as well as in lab. Okay, so this is one of the most important impression material for taking the final impression. So in this video we will be discussing with every aspect of this zinc oxide Eugenol impression paste, and in the previous video, as you know, that we have discussed with the impression compound. Okay, so in that video, in second video of this impression material, we have discussed properly about everything. Okay, so classification, application with its manipulation, setting, reaction. Okay, so every aspects of things. Okay, so every things that are to be covered in impression compound, so I have covered there in that video, and in this video we similarly in such a pattern we will be covering this zinc oxide Eugenol impression paste. So you guys should concentrate properly and listen to me. So without delaying much, let's get started. So as I have written here, okay, so zinc oxide Eugenol impression paste. Okay, so this is our topic of today's video. So it is a rigid. Okay, so it is a rigid, okay, irreversible impression material, means it is not reversible, and in the edentulous. Okay, so it is a bit similar with that of the impression compound, but the similarity, but the difference is this irreversibility. Okay, so it is a irreversible compound, okay, but impression compound is a irreversible. As you know that we can just manipulate it for a several time. Okay, it sets and again we can soften it, and again we can take the another impression, okay, by loading onto the tray. So it is a reversible type of impression material, but it is a irreversible. Okay, so which is the difference between both impression materials. So now the in classification, so in the classification, as I have written here, according to the ADA specification number 16, so we have type 1 and type 2. So type 1 is the hard and type 2 is the soft type of zinc oxide Eugenol impression paste. Okay, so this is important, and the ADS specification number is a 16. Okay, so according to the 16, okay, so it is type 1 and type 2. Type 1 is the hard and type 2 is the soft. And availability, okay, so in the two forms, okay, so it is available in the two paste system. Okay, so in the previous video I have discussed somewhere, I think I remember it. So there I have told there that zinc oxide Eugenol, okay, so this impression paste have the two paste. Okay, so one paste is a base and another paste is a accelerator or the catalyst or the reactor. Okay, so it is a accelerator, catalyst or the reactor, and base paste is the white color and this reactor is of red color. So R for R, you can remember like that. Okay, so reactor is the red in color and this base paste is the white in color. Okay, so it is two paste. So it is available in the two forms. Okay, so one is a base, another is a accelerator. Both are in the paste form, and that is the availability of this zinc oxide Eugenol impression paste. So I think you are clear in this, and you should remember this color. Okay, so white is base and red is the this accelerator. So sometime in the practical exam, okay, so they can ask in the viva, in table viva, okay, so tell me which is a base and which is a accelerator. So during that time you may get confused. Okay, so either white is a accelerator or it is a base. Okay, so just remember this, R for reactor, R for red. Okay, so red means reactor. So after that, in the application in the dentistry, okay, so it is one of the important here topic in this chapter, that is cementing application in dentistry. So the first point is cementing and the insulating medium. Okay, so it is used as a insulating medium. Okay, so we can use it as a cementing and the insulating medium. Similarly, in the second point, it is also used as a temporary filling material. Okay, so we can use it as a temporary filling material. We can use it for the short duration. Okay, for the filling purposes. Similarly, root canal filling material. Okay, so root canal filling material. After that, in the 4th point, okay, so it is one of the important point of this zinc oxide Eugenol impression paste application. So that is a surgical pack or the periodontal surgery. Okay, so what we do in this periodontal surgery, okay, so during the surgery of this gingiva. Okay, so when the flap of gingiva is removed, okay, so there is exposure of the root of the tooth. Okay, cementum of the tooth is exposed, similar, so that there would be incorporation of the microbes in those area. Okay, so for sealing that zone, okay, as as during surgery. Okay, so just I will show you the picture. Okay, so just think this is a tooth. Okay, so this is a tooth and this is a gingiva. Okay, and this is a gingiva. Okay, so this is a gingiva and this flap of tissue is taken out. So when this flap of tissue is taken out, this is exposed. Okay, so the root of this tooth is exposed, so that the microbes can get and incorporate in this. Okay, so that for sealing this zone, okay, we use this zinc oxide Eugenol impression paste for sealing those zone. Okay, so we just apply this as a surgical pack. Okay, so they are the okay sealing material. Okay, so we just apply here. Okay, and as you know that the tissue in this area will be coming in some time. Okay, but for short duration. Okay, for not incorporating the microbes with the root of the tooth or the internal area, the surgery portion. Okay, so it act as a insulating medium and it insulates the microbes from those portion of the tooth. Okay, so in the periodontal surgery it is one of the most important. Okay, so it is used as a surgical packs. Okay, after that it is used also as a corrective impression. Okay, so we can corrective impression. Okay, similarly the bite registration paste. Okay, so I think I have written in the last paper about this bite registration paste. Okay, so in the bite registration property of this material, it should have more plasticity. Okay, so if it have the more plasticity, it would be better in taking this bite registration. Similarly, our another application is a relining material. Okay, so relining material means patient use okay, so when the patient, okay, so when we prepare the complete denture for any patient, okay, and if the denture becomes loose after certain time, okay, so that we can, so the patient comes in the clinic and at that time we can use this zinc oxide Eugenol for reline that and seal that. Okay, so it won't be loose now and it would be properly attached to the tissue, so it is used as a relining material. So you should remember this application in the dentistry, so it is one of the important topic in this chapter. So our first is a cementing and the insulating material. Okay, so it is easy, so it just insulate, so we can use that cementing or the insulating material. Another is a temporary filling material, another is a root canal filling material. Okay, so root canal filling material and the surgical packs or the periodontal surgery. Okay, so after periodontal surgery, when the flaps of gingiva are exposed, so for the sealing of those zone, okay, we can use this zinc oxide Eugenol. Okay, for sealing those zone. Okay, and after that our fifth is a corrective impression. Okay, and sixth is a bite registration paste and the relining material. Okay, so these are the application of the zinc oxide Eugenol impression paste. And after that our another topic is a composition. Okay, so in this composition, okay, so this is the one, this is also important here. Okay, so they are mostly important in the theory exam. So in theory exam they just tell about the write about the composition of the zinc oxide Eugenol impression paste. So at that time you should write the constituent with their percentage present in that. Okay, so it is important. In impression compound also I have discussed properly about the constituent. Okay, and I have also gave you, and I have also give the mnemonics there. Okay, so you can remember that, and that is also important. The composition of the impression compound is also important in this impression material chapter, and also the composition of this zinc oxide Eugenol is also important, so you should remember this. And after that, okay, so let's discuss this. Okay, so the, as I have told here, okay, so it is available in the two paste form. One is a paste form, one is a base paste, another is a accelerator paste. So in the base paste, okay, so we have zinc oxide, another is a vegetable or the mineral oil. Okay, so zinc oxide, it is a one of the major constituent of the base paste. In the white paste, okay, so in the white paste we have zinc oxide, which is a major constituent and it is a 87%. Okay, and another is a vegetable or the mineral oil. Okay, so which is 13% and it is a second major component of this base paste. Okay, so we have properly two components present in this base paste. So one is a zinc oxide, another is a vegetable or the mineral oil. and this zinc oxide is a finely divided and should contain slight amount of the water. Okay, so it is a there is a finely divided, okay, zinc oxide, okay, that is present in this base paste are finely divided and should contain the slightly amount of the water. Okay, so slight amount of water should be present there and it should be finally divided. Okay, so it should be the particle size should be too much small. Okay, after that our another constituent is a vegetable, so it acts as a plasticizer. Okay, and it aids in masking the action of the eugenol. Okay, okay, so this vegetable oil or the mineral oil act as a plasticizer. Okay, so it increases the workability. And another importance of this vegetable or the mineral oil is that, okay, so it aids in the masking the action of the eugenol. Okay, as the eugenol, okay, so it is a irritant. Okay, so it is one of the irritant. It just irritate, it gives the burning sensation to the tissue. Okay, when you just apply the eugenol. So to mask that, okay, so to overcome those properties of this eugenol, okay, as the eugenol is present in the accelerator, we will be discussing with that. Okay, so to mask the action of the eugenol, so to mask the irritant property of the eugenol, we just use this, okay, we just use this vegetable or the mineral oil. Okay, so remember this zinc oxide and the mineral oil in this base paste. Okay, so now, okay, so in this accelerator paste now, okay, so in the accelerator paste, okay, I think it is visible here. Okay, so in this accelerator paste, okay, so in this accelerator paste, okay, so we have properly measure 6 constituent present here. Okay, so and I have prepared the proper mnemonic. So by using this mnemonic you can remember all those constituent and you do not be worried anymore in those constituent portion, okay, of this dental material. I am sure that in every composition, okay, I will try to prepare the proper sophisticated mnemonics that will be easy to remember all those composition, okay, and that will remain in your memory for the longer time. So just follow those mnemonics. Okay, if you want to, if you feel comfortable in this mnemonic, then you can learn those mnemonic, and also you can prepare your own mnemonics. Okay, and mnemonics makes things to remember for a longer time and it is easy to remember also. So as I have prepared here mnemonic, that is a golf CR. Okay, so CR means class representative and golf means a game. Okay, so golf CR. Okay, and golf is played by the CR. Okay, so anything you can just make and you can remember. So golf CR I have prepared. So G means gum or the polymerized rosin. Okay, so which is present in a 50%, and another is the oil of cloves or the eugenol. Okay, so this is present in a 12%, and another is a lanolin that is in a 3%, filler that is silica type. Okay, so in this filler, okay, you can use, okay, other materials too, like this kaolin, talc and diatomaceous earth are also can be used in this filler. Okay, which is in the 20%. After that, this calcium chloride and this color. Okay, so this is present in the 5%, and this resinous balsam that is present in the 10%. Okay, so we have proper 6 major constituent. So you can remember G for gum or polymerized rosin, O for oil of cloves or the eugenol, L for lanolin. Okay, L for lanolin. After that, filler silica type, diatomaceous earth, talc, kaolin. Okay, and in CR means calcium chloride and the color. Another is a resinous balsam. Okay, so which is present in 10%. Okay, so 50, 12, 3, and so just you can remember like this. Okay, so 50 means just 50. Okay, after 50, 12 plus 3 means 15. Okay, so 12 plus 3 is 15 here, and 10 plus 5 is 15 here. Okay, so you can remember like that. Okay, so in above 2 there, in addition becomes 15, and in below 2 addition become 15. Okay, so I will write here, then it will be easy when you revise it. Okay, so 12 plus 3 15, 5 plus 10 15, and filler means 20, remaining portion is 20. So you can remember like that way. And also previous it was easy, 87 and 13. Okay, so that was the percentage there. Okay, now, okay, some important points as I have written here. Okay, so you should discuss this. So oil of cloves, okay, used in a preference to the eugenol because it reduces the sensation. Okay, so as I have written here, oil of cloves or the eugenol. Okay, so this eugenol have one disadvantage is that, okay, so it is giving the irritation. Okay, it just gives the burning sensation to the patient when we apply this eugenol. So to overcome this, okay, we have used the vegetable or the mineral oil, okay, in the base paste, as I have discussed previously. But also the sensation of this Eugenol is not overcome. So that in such a case we use this oil of cloves, okay. So in the preference to the Eugenol, okay. After that, gum or the polymerized rosin, it increases the reaction and increases the homogeneity, okay. So gum or the polymerized rosin, okay, so it increases the rate of the reaction, okay. So rate of reaction is increased by this, so it properly works as a accelerator. It accelerates the reaction and it improves the homogeneity, okay. So you should remember these 2 points about this polymerized rosin. And the next point, as I have written here, Canada and the Peru balsam, okay. So it improves the flow and it improves the mixing properties, okay. So the function of this Canada balsam or the Peru balsam is that, okay, so it improves the flow, okay. So the flow of the material is improved and it also improves the mixing properties. Similarly, CaCl2, okay, so CaCl2, calcium chloride, okay, so it act as an accelerator, okay, similar like that of this polymerized rosin and the gum. It is also increasing the reaction here, and the proper accelerator that is present in this accelerator paste is a CaCl2, okay. So it is a chemical. Similarly, other accelerator that we can use is the zinc acetate, primary alcohols, glacial acetic acid, okay. So we can use the carboxylic acid, alcohols, okay, acetate, okay, and CaCl2. So CaCl2, just remember this, okay. So this is important, so they can ask in the viva. So calcium chloride, and another accelerator is a zinc acetate, another is a primary alcohols, and another is a glacial acetic acid, okay. After that, in the last point, as I mentioned here, if mixed paste, okay, is too thin or lacks body, okay, before it's set, a filler, wax, or the inert powder such as kaolin, talc, or the diatomaceous earth can be added, okay. So the point wants to tell us that, okay, so in the case of the, okay, lacking body, okay, or it is thin, it is too much thin, okay. So it is just too much thin and it have not proper stability, okay, and it is not having the proper body. In such a case we can use the filler, okay, as it gives the strength to the matrix of the set matrix of the set material, okay. So in the filler we can use the wax or we can use the inert powder such as kaolin. So I will underline by the red, okay. So in the filler as a wax or as a kaolin inert powder, okay. So we can use this inert powder such as kaolin, talc, or the diatomaceous earth, okay, can be added here, okay. Okay, so after this, okay, in the setting reaction, so in setting reaction now we will discuss with this. So it is a acid base reaction, okay. So acid and the base, so they just to get react and form the chelate, okay. So chelate means, okay, so chelate is formed, chelate means matrix is formed, okay. So okay, acid base reaction, it forms the chelate, okay. After that reaction also known as chelation and product is the zinc eugenolate, okay. So reaction is also known as chelation and the product that is formed, that is a zinc eugenolate, okay. So the reaction is present here. So in the setting reaction it is a bit of acid and base reaction, okay. So it is quite of ionic reaction, okay. So acid and base, they just replaces their OH portion, okay. So hydroxyl portion and the hydrogen portion of acid and OH portion of the base, okay. So there is an exchange of those portion of the compound and there is formation of this salt, and that salt is the zinc eugenolate, okay. And this zinc eugenolate is a chelate, it is a matrix, okay. So the zinc eugenolate chelate or the matrix is formed. So in the first portion of the reaction we just do hydrolysis. So in hydrolysis, zinc oxide plus water gives the zinc hydroxide, and the next portion of the reaction, okay, so acid and base reaction, so zinc hydroxide plus 2Nc, so it is acid and it is a eugenol, okay. So acid and it is a eugenol. So this base and this eugenol, okay, so this oil of cloves or the eugenol as well as it was present in the accelerator paste, so they just get react and they just form the salt, okay. So that is a zinc eugenolate salt and the water is produced there as a byproduct. So this is a one of the important setting reaction in the dental materials subject, okay. I am telling the dental materials subject, not in this impression material, okay. So this is very important, this setting reaction of this zinc oxide eugenol and also the setting reaction of the alginate, okay. So these two both compound have the important setting reactions in this dental material subject. Okay, and they are asking in the exam, in theory as well as in the viva exam. Okay, so you should prepare it well, and it is very easy. Okay, so first is hydrolysis and another is a acid base reaction. So that is the both, that is the two portions of the two steps of the this setting reaction. Okay, so now we will discuss with this microstructure after this setting reaction. So the microstructure of that is formed after setting of this reaction is that, okay, so there is a zinc oxide particle. Okay, so zinc oxide was present in the base portion of the paste. Okay, so in base paste there was a zinc oxide particle and it react with the eugenol. Okay, it reacts with the hydrogen and it forms the hydroxide, and again it reacts with the eugenol. Okay, so the unreacted zinc oxide particle is present in the matrix. Okay, so in the matrix of the chelate or the matrix of the zinc eugenolate. Okay, so zinc eugenolate matrix. Okay, so it is present in the zinc eugenolate matrix. Zinc oxide particle is present there. Okay, so that is a microstructure. After that, chelate forms amorphous gel, crystallize, giving strength to the set mass. Okay, so chelate that is formed. Okay, previously it was in the amorphous gel form, and with the time it just gains the strength and it forms the set mass. Okay, so set mass is formed after some time. Okay, so it just crystallize and giving strength to the set mass. After that, zinc acetate dehydrate. Okay, so zinc acetate, as I have mentioned here, zinc acetate dihydrate. Okay, so it is acylator. Okay, so it acylate and it is more soluble than zinc oxide, zinc hydroxide, and it crystallizes the zinc eugenolate. Okay, so this acylator helps in the strengthening. Okay, so it helps in the formation of the crystalline zinc eugenolate fast. Okay, so that is the important of this zinc acetate or the calcium chloride. Okay, so CaCl2 zinc acetate have such function, so that they act as a acylator, and as they are more soluble than this zinc hydroxide. Okay, so zinc hydroxide is formed by the zinc oxide plus water, so they are more soluble than this zinc hydroxide and they form the crystalline zinc eugenolate. Okay, so it increases the rate of forming this crystalline zinc eugenolate. Okay, so that is the important thing you should remember from this paper. Okay, now setting time. So in this setting time, okay, so it is also not a bit difficult to remember, you can remember it easily. So this chapter is very easy. Okay, compared to the dental cement chapter. Okay, so you can easily remember everything, but in dental cement, okay, so there was lots of data. Okay, so compressive strength, tensile strength, this that. Okay, so there was lot of data present there, but here is not too much data. Okay, you can easily remember, but in this dental material subject, okay, so there are lots of data and you cannot afford to just leave those. Okay, you should remember all those data. Okay, so try to remember all those data. And in the setting reaction, so we have initial setting time and another is a final setting time. So we have two setting times. Okay, so initial setting time means that time. Okay, so it is a beginning of the mixing to the new strings are formed. Okay, so just think. Okay, so in the manipulation I will tell here. Okay, so just look this picture. So we have dispensed the equal length and the equal diameter of the accelerator paste and the equal length and the equal dimension of the base paste here in the glass lab. Okay, so after dispensing this, okay, we just mix it with the stainless spatula. Now while mixing, so when you start to mix it, okay, so the beginning of the mixing to the no string formation. Okay, so the no string formation, no strings are formed. Okay, so the duration between these 2 points, okay, and the time that is between this. Okay, so no string formation here. So strings means, so when you just pull this impression material, okay, so the dispensed so the mixed this impression paste. Okay, so when it is properly mixed and when you just pull this stainless spatula from that mix, then there is a formation of the string. Okay, and I have discussed with this formation of string in the zinc phosphate. Okay, so there was also, it was a very important. Okay, so string formation. Okay, so it gives us the information about the luting consistency or the restorative consistency. Okay, so similar here, so the beginning of the mixing to the no string formation. Okay, so this time duration is the initial setting time. and impression should be seated before the initial set. Okay, so impression, as you just mix it and you just put on the custom tray and you just take the impression. Okay, so in this initial setting time you should be completed with all those steps. Okay, so you should load those, okay, mixed manipulated paste in the custom tray. Okay, so it should be properly seated before the initial set. Okay, so that is the significance of this initial setting time. And the final setting time means, okay, so it is that time, okay, and it is after this initial setting time. So final setting time means the needle of the specified dimension, it fails to penetrate the surface of the specimen more than 0.2 mm under the load of the 50 gram. Okay, so this final setting means, so after this initial set, so it get finally setted. Okay, so it becomes hard. So how to know it had reached to this final setting time is that, okay, so we just take a needle of the specified dimension and we just penetrate the surface. Okay, so just think this is a set mass and we just penetrate it. Okay, so we just penetrate it, and after penetrating, okay, so it is unable to penetrate the set substance. Okay, and the specimen more than 0.2 mm under the load of this 50 gram. Okay, so this dimension is important here. Okay, surface of the specimen more than, okay, so the surface, okay, of the specimen. So specimens means this mixed zinc oxide Eugenol paste. Okay, so after mixing the zinc oxide Eugenol paste, okay, so we take minimum of 0.2 mm thickness paste. Okay, and we just apply the force. Okay, we just apply the load of the needle. Okay, and the load of the needle should be 50 gram. Okay, so the thing that is telling here is that, okay, so 0.5 mm of the thickness of the specimen and the 50 gram of the load is applied on it. Okay, and it is not being disturbed. Okay, so that is a final setting time, and which is important. And and it doesn't penetrate in this time. Okay, so it fails to penetrate, so you should remember this. So that is a final setting time. Okay, so this is a way to know whether it have reached the final setting time or not. Okay, after that their data is present here. Okay, so initial setting time in type 1 and type 2 both have 3 to 6 minutes, but in type 1 we have 10 minutes and in type 2 we have 15 minutes. Okay, so that is the data you can remember. So initial set time is similar in both the types of the impression paste, but in the final setting time we have 10 minutes in type 1 and type 2 we have the 15 minutes. Now the factor controlling the setting time. Okay, so we have proper 7 points here and you should remember all those points. Okay, and this is very important, they can ask you in the theory exam. So in the first point, as I have written here, the particle size of the zinc oxide powder. Okay, so smaller the particle and the acid coated small particles are less setting time, having the less setting time. Okay, so just remember, if the particle size is small, okay, and it is coated with the acid, okay, and it is coated with any acid, then the setting will be faster and the setting time will be decreased. Okay, so less setting time will be there. After that, if increase in the mixing time would decrease in the setting time. Okay, so when you just mix it for the longer period, okay, so there will be proper mix between the base and the accelerator, and you just take the time of the setting time too. Okay, so that there will be decrease in the setting time. After that, high atmospheric temperature and the humidity accelerates the setting. Okay, so due to this high atmospheric temperature and the humidity, okay, so in our mouth when you just take the impression, it just gets set faster. Okay, because there is a presence of the humidity in our mouth. So the high atmospheric temperature and the humidity, it accelerates the setting. And in the another point, so water plus acetic acid, so when, okay, so water plus acetic acid, it just increases the reaction rate and decreases the setting time. Okay, so in the previous paper there I have written, okay, so there should be presence of this. Okay, so I will show you here. Okay, so this here I have mentioned zinc oxide finely divided and should contain the slight amount of the water. Okay, so this water or the acetic acid will helps in increasing the rate of the reaction and decreases the setting time. Okay, after that, in another point, cool mixing slab, spatula or adding a small amount of the retarder or the oils or the waxes would increase the setting time. Okay, so it would increase the setting time, means cool mixing slab, spatula or a small amount of the retarder like oils or the waxes. Okay, so waxes we have used as a fillers too, and this can be used as a retarder too. Okay, so oils and the waxes can be used as a retarder too. Okay, so these are the retarders. Okay, so they just decrease the setting reaction time, so they are the retarders. Okay, so they just increases, okay, sorry, they just increase the setting time. Okay, so I think I have told mistake previously. So they are the retarder, they would increase the time of the setting, so that there will be increase in the setting time. Okay, and zinc acetate dihydrate. Okay, so it is accelerator and it produce more zinc and it increases the decrease the setting time. Okay, so zinc is present there, so more zinc is released from this. Okay, and also in the previous paper I have discussed that zinc acetate dihydrate, it is more soluble, okay, than that of the zinc hydroxide, and it helps in the crystalline, it helps in the crystalline. Okay, so the crystalline matrix is formed more fast by the presence of this zinc acetate, so it produces the more zinc and it decreases the setting time there. After that, varying length of the two paste not be recommended. Okay, so the if you just take the varying length, okay, so in manipulation section I will be discussing. Okay, so the length and the diameter of the both the paste should be similar. Okay, and that will give the proper and homogeneous mix between the substances. But if the length and the diameter is not same, okay, and it is not equal, then there will be not proper mixing, and that would lead to the increase in a setting time. Okay, so now we will discuss with this manipulation section. Okay, so in this manipulation, as I have written here, as I have shown in this picture. Okay, so we take the accelerator and we take the base. Okay, and we just dispense from the tube, okay, on this glass slab with the same diameter. Okay, so the same diameter and the same length. Okay, so the length you can see it is a bit similar. Okay, and the diameter is also similar in both the both the dispenser. Okay, so the accelerator and this is a base. Okay, base, and the mixing is done on an impervious paper or the glass slab. Okay, impervious paper we can also use that, or the glass slab is better. Okay, so you just go with the glass slab. After that, the flexible stainless steel spatula is used. Okay, I think we have used this flexible stainless spatula. Okay, so it is used everywhere. So this flexible stainless spatula is used. So the mixing time, that is 1 minute here. Okay, and you should also remember the initial set and the final set. Okay, so type 1 it have 3 to 6 minutes, type 2 also 3 to 6 minutes, and the final set it is 10 minutes and the 15 minutes. Okay, after that, two ropes are mixed until a homogeneous color is not obtained. Okay, so two ropes are mixed, okay, until the homogeneous color is not obtained, and the custom impression tray made up of the stable resin is recommended, and the material is loaded into the tray by sweeping on the sides of the tray and spreading in the smooth uniform motion. Okay, so that is under this manipulation. Okay, so after this manipulation, so impression is rinsed and placed in disinfectant, that is 2% alkaline glutaraldehyde, and as with the most impression material, immediate pouring of the cast should be done. Okay, so I'll just tell you the proper way of the manipulation, and I have recited all the points here, and you should remember all those points. Okay, so first what we do is we just take the clean and the cool glass slab. Okay, so the cooling of the glass slab would increase the setting time. Okay, so as I have discussed previously, so we take the cool and the proper clean glass slab, and we just dispense the proper length and the diameter of the Okay, so I am stressing in this point. Okay, you should remember this, and this is very important, and you can't afford disturbing the quantity, okay, during the dispensation. Okay, so you should remember this, and this is very important. So you should dispense the proper length and the proper diameter of the paste on the glass slab of both base and the accelerator. Okay, and the color of the base is the white and accelerator is the red. Okay, so I have discussed previously. So after dispensation, okay, we just take the proper stainless steel spatula. Okay, so we take that stainless steel spatula, and what we do is we just start to mix. Okay, we just start to mix both the paste. Okay, and we just mix properly. Okay, so we just move our hand in circular pattern. Okay, also we can just we can sweep like that. Okay, or we can do in the circular motion. So our main motto is to give the proper mix to that substance. Okay, you can move in any pattern. After mixing, okay, so there becomes a uniform color. Okay, so we can obtain the uniform color as the white and the red color. Okay, so when they mix, okay, so slightly of pinkish color is obtained there. Okay, so just remember, a homogeneous color should be obtained. Okay, so after the obtaining of the homogeneity, okay, in the color, so after that okay, that substance is loaded onto the custom tray. As I have discussed, it is used as for the final impression. Okay, so it is not used for the primary impression, it is used for the final impression. So the final impression is taken by the custom tray. Okay, so it is fabricated by the resin. Okay, and that is prepared by the primary cast. Okay, that is prepared from the primary impression. Okay, so I think you should remember that, you have remembered that. Okay, so the from primary impression we just make the primary cast. Okay, and from the primary cast we make the custom tray, and in the custom tray we just pour this substance, and we just think this is a custom tray. Okay, and we just take from this stainless spatula and we just slide on the okay sides. Okay, so we just slide on the side and we just move this. Okay, and we just, and using this stainless spatula we just properly disperse on the custom tray. Okay, and make sure ear bubbles shouldn't be incorporated in that. Okay, so we can move this, tap this. Okay, so the ear bubble shouldn't be incorporated in this mixer. Okay, so that is important here. So as with the most impression material, immediate pouring of the cast also should be done. Okay, so after this much, okay, we just take the impression, and impression is taken out and it is rinsed and it is placed in the disinfectant, which is 2% alkaline glutaraldehyde. And after disinfection we just pour the impression material. Okay, as soon as possible we just pour the impression, we just pour the gypsum product. Okay, so the cast material we just pour onto this, and we just make the fabricate the secondary cast. Okay, so secondary cast is prepared. Okay, so in such a pattern we can just use this zinc oxide Eugenol. Okay, so after this manipulation we can go in properties now, and in the properties, so our first property is consistency and the flow. Okay, so as it is used in a final impression, so and the criteria of the final impression is that, okay, so it should have the proper details. Okay, so in the final impression we should record every important, okay, so every small details of the oral tissue, so that the flows of the material should be more. Okay, so the similar here in this zinc oxide. Okay, so it have a more good flow than that of the impression compound. Okay, so impression compound was not having the proper flow, so it is used as a primary impression taking material, but it have the proper flow, so it is used as a final impression. Okay, so you should remember, and same thing is written here. So the thick consistency, so in this zinc oxide Eugenol 2, okay, so we have type 1 and type 2. So in type 1 we have okay, so it is hard type of material, so the thickness is 30 to 50 mm, and it have little less flow, but it is more flowable than that of the impression compound. Similarly this type 2 paste, and it have a very small thickness, that is 20 to 45 mm, and it is more flowable than that of the type 1. Okay, so you should remember this data, 30 to 50 and 20 to 45. Okay, and thick consistency means type 1 it compresses the tissue and take the impression. Okay, and thin consistency it copies the every details of the tissue without distorting it. And after another point, okay, so detailed reproduction due to the proper flow. Okay, so if the flow will be better, okay, so if the flow will be better, it would take the every small details of the tissue, and if the flow is not better, okay, so the thickness, the consistency is harder, and it cannot take the proper details of the tissue. So the detailed reproduction is taken by this zinc oxide Eugenol is good. Okay, as it have the good flow, so you should remember that. After that, rigidity and strength. Okay, so in this point you can just compare. Okay, so impression compound is more rigid and more strengthful, okay, than that of the impression, than that of this zinc oxide Eugenol. Okay, as it resists the distortion and the fracture. And after that CS, okay, so compressive strength is 7.7 MPa, and for the 2 hours after the mixing. Okay, so rigidity and strength. Okay, so it is a less rigid and less strengthful than that of the impression compound, and you can remember this data. Okay, so CS is 7 MPa. After that, in dimensional stability, okay, so it is having the satisfactory dimension stable, satisfactory dimensional stability. Okay, after that negligible shrinkage is present here, okay, which is of less than 0.1% and may occur during the hardening. Okay, so during hardening there is a shrinkage and it is a negligible. Okay, so that is less than 0.1%. and the biological consideration, okay, so the burning sensation in the mouth is due to the Eugenol. Okay, so burning sensation in the mouth is due to the eugenol. Okay, so that is one of the disadvantages of this zinc oxide eugenol. So to overcome this eugenol, we have taken the oil of clove and also that plasticizer, vegetable oil or the mineral oil. Okay, so they just marks the sensation of this eugenol. So just remember the properties. We have proper flow in this zinc oxide Eugenol impression paste, and we have less rigidity and strength present here, and in dimension stability we have satisfactory kind of dimensional stability. Okay, and negligible shrinkage is present there, that is 0.1%. okay, so less than 0.1% shrinkage is present there, so that it is dimensionally stable. And the biological portion, it gives the burning sensation due to the presence of the eugenol. Okay, which is a disadvantage of this paste. Now in the advantage and the disadvantage, okay, so it is having the good consistency and the sufficient working time. Okay, another point is a register details. Okay, so it is used as a final impression material. Okay, after that stable dimensionally and correctable and doesn't require the separating media, and after that enough working time to complete the border molding. Okay, enough working time. Okay, it have enough working time to complete the complete border molding. Okay, so that is important. Okay, so that are the advantage of the zinc oxide eugenol paste. And the disadvantage, okay, so requires the special tray for the impression, which is a custom tray. Another, it is sticky in the nature and adheres to the tissue. Okay, so it may cause problem sometimes. Okay, so it is quite of sticky. After that, in the eugenol, okay, so as it is sticky, okay, so it is one end of the advantage too. Okay, so during the loading of the impression material on the custom tray, okay, so it is not so adhesives are not used there. Okay, so as adhesives are used to adhere the substance to the tray. Okay, so and it is sticky. Okay, so we should not use this should not have to use this adhesive to stick this substance onto the tray. Okay, so that is one of the advantage. But another disadvantage is that as it is sticky, okay, so it adheres to the tissue. After that, in eugenol, it gives the burning sensation and it is inelastic in nature, so can't be used in undercuts. So it is inelastic in nature. Okay, and can't be used in undercuts. Okay, so previously also in the first paper I have told there, it is only used for the edentulous patient. Okay, so when you are fabricating the complete denture, okay, so when you are fabricating the complete denture of the edentulous patient, in those patient you can use this zinc oxide eugenol for the final impression. Okay, so I'm not discussing more about this advantage and disadvantage, so they are taken from the this properties section and this another things that are discussed in this video. Okay, so you can just relate those. Okay, so this is having the good consistency, sufficient working time. Okay, so it is taken from here. Register details also taken from here. Stable dimensionally taken from here. Okay, so you can prepare your own advantage and disadvantage like that. Okay, so this eugenol, it is one of the disadvantage. So this is one of the important disadvantage of this. Okay, you can't miss this in a viva when just they can ask, tell me the disadvantage of the GADOE, and at that time firstly you should tell it is a having the eugenol and that gives the burning sensation to the patient. Okay, so that is one of the prior disadvantage of this zinc oxide eugenol. Now our another, okay, so small points I have mentioned here. Okay, so in the non-eugenol impression paste, okay, so for overcoming this eugenol, okay, we have used the oil of cloves and we have also plasticizer, but also we can use another substitute of this eugenol. Okay, and that is a carboxylic acid. Okay, and that is RCOH. So this is a carboxylic group in place of the eugenol. Okay, so there is also a presence of the non-eugenol impression paste in a market, and that constitute of the carboxylic acid. Okay, so orthoethoxybenzoic acid is present here there. Okay, priorly orthoethoxybenzoic acid. Okay, and our in another point, bite registration paste. Okay, so in the application, as I have told there, it is also used for the bite registration, and the main thing that is to be present in the compound for the bite registration is the plasticity. So here I have mentioned it should contain the more plasticizer. Okay, that prevents the sticking to the teeth or the occlusal. Okay, so it should be more plastic. So it should be more plastic. Okay, so that workability should also be increased and it should be prevented from sticking to the tooth. Okay, and also shorter setting time prevent the distortion. Okay, so Okay, so for the bite registration paste we have shorter setting time. Okay, so it should set faster so that we can take bite registration, and also it should contain the more plasticizers. Okay, we just prevent the sticking to the tooth or the occlusal rims. Okay, so we have covered all the points of this chapter, zinc oxide Eugenol, and which is one of the important chapter. Okay, and in this dental material, as you know that, okay, we have lot of data and the things, okay, to remember. Okay, but you can just remember by just linking all those data. Okay, just like here. Okay, you may be troubling in this. Okay, how to remember this setting time. Okay, so the factor controlling setting time, so it is very easy. Okay, in maximum chapter, okay, of this dental material you can see similar kind of pattern. So if the particle size is small, then it would set faster. Okay, so that is one of the tactics. Another tactic is that, okay, so mixing time is increased, setting time is decreased. So it is similar in all the chapter. Similar, high atmospheric temperature, humidity, it also increases, accelerate the setting. So it is also similar with the other materials too. Okay, so you should relate all the points. Okay, and that will make easy to understand everything. So after saying this much, and so if you have loved this video, okay, please do like, subscribe and share with your batchmates, and I will meet you in the next video, next part of this impression material. Okay, maybe the alginate. So we will meet in the next part. Till then, stay happy, stay healthy, and go through the points. Okay, go through the notes, and after watching all those video, and I post the note in the Telegram channel. So you take the note from the Telegram channel and just revise all the points. Okay, and you shouldn't be worried in this chapter anymore. I think I have covered everything here, so you should trust me. And the point that I have written here, you should be mastered in those points. Okay, so that it won't be troubling you during the exams. So just take all those points in your minds. Okay, take all those concepts, keep in the mind, and just revise. Okay, just remember it. Okay, so after telling this much, I'll meet you in the next video. Okay, till then, stay happy, stay healthy. Tata, bye bye, thank you.